Welcome, my name is Dawn Macary with the Western Connecticut Area Agency on Aging, and we have a new show entitled Working Together with the Western Connecticut Area Agency on Aging. Our agency serves 41 towns of Western Connecticut. We offer free, unbiased information to individuals on Medicare and persons with disabilities on Medicare regarding Medicare insurance, Medicare Part D, Medicaid, new to Medicare, respite care, the home care program, money follows the persons, assistance filling out application, the Senior Medicare Patrol, which is Medicare fraud, and a variety of other programs to help keep individuals independent and at home. And today I am really happy to have as our guest, we have two of them today, Magaly Bravo, and she is a Regional Choices Coordinator at the Western Connecticut Agency on Aging. Welcome.
Thank you.
And we have a Choices volunteer, Amanda Halle.
Thank you.
Thank you, Amanda, for coming. This was very nice of you. It's nice, always nice to have a volunteer on the show.
I'm very happy to be here.
So before we get going, Magaly, can you tell the audience a little bit about yourself?
Yes, I'm the Choices Director for Western Connecticut Area Agency on Aging. I work with Medicare, with Medicaid, and other related health insurances. And I really love to, talk to people, to consult, and to give them the information that they need.
And she's very good at it, I could add too. And Amanda is our volunteer. Amanda, could you tell us a little bit about yourself?
Sure. After about 25 plus years working in the medical education field, followed by taking care of my elderly mother, I learned a lot about the lack of information about Medicare, and learning how to navigate that system can be quite challenging. I therefore got interested in aspects of elder care and asked around and was suggested to consider training to be a Choices counselor. I therefore then found the Western Connecticut Area Agency on Aging, who offered such a course, and I took the course over a year ago and have been counseling ever since.
And we are so happy to have her, aren't we, Magaly?
We are.
Thank you.
She comes in a couple times a week and she gets the phones that we're going to talk to her a little bit later. Magaly, can you tell us what is a Choices program?
Choices program, it's we provide free and unbiased information about Medicare, Medicaps, Medicare Advantage plans, Medicaid, and other health insurance related to Medicare.
Okay. Well, what does Choices stand for?
It's the Connecticut's Program for Health Insurance Assistance, Outreach, Information and Referral Counseling, and Eligibility Screening.
Boy, that's a big title, yeah.
Yeah.
I know in Connecticut it's called Choices. I know in Florida they call them Shine. And I think throughout the rest of the country they call them...
It's a SHIP.
It's a SHIP, State Health Insurance Providers,
yes.
Right.
Yes.
And like I said, the best thing is that they offer that free, unbiased information. So if I go in to see if you're a client and you call Magaly and you are not sure what to do about Medicare, they're going to offer you the information, but they are not going to tell you exactly what plan to get. They leave these choices up to you, but they give you all the information that's needed. Is this program statewide? In Connecticut?
Choices is statewide. It is. It's a federal program known as SHIP, and SHIP is known in the state of Connecticut as Choices.
Okay, and the number is on the CMS book, is that correct?
It is. In the Medicare and You book, in the back of the book, you're going to see our telephone number. In the state of Connecticut, like I said, we're Choices, and you're going to see also the SHIP number. We have a 1-800 number that you can call.
I know we do get a lot of calls, right, Amanda?
We certainly do,
Oh,
from all over the state sometimes.
Yes, all over the state, because we have an 800 number, and sometimes it gets a little bit mixed up and goes to the wrong area. What type of services do you offer as Choices? Like, why would I call you?
Different reasons. If someone is new to Medicare, we can explain them what's Medicare, what's covered, what's not, how much is the person expected to pay for some services. That's one of the main things. Or sometimes someone who is already on Medicare, we can explain them what choices they have. For example, if they can buy like a Medigap or a supplement to help them with the Medicare cost.
Because Medicare does not pay for everything?
No, it doesn't pay for everything. It doesn't pay once a service is covered, doesn't pay fully for that. There's a shared cost that the client has to pay for.
Okay,
Yeah.
and on the new to Medicare, if my memory serves me right, you did some seminars this past year for people that were new to Medicare?
Yes, yes, we definitely do that in our 41 towns. We do presentations to explain what Medicare is and what options they have. We talk sometimes also about programs that can help them pay for Medicare as well.
Oh, really? Okay.
Yes, that's one of our focuses, to go out there and talk to people, either that they're already in Medicare or they're new to Medicare, even better.
Okay, so yeah, because if you're new to Medicare, I mean, someone is once called Medicare alphabet soup, because you have Medicare A, B, C, and D, and it really is alphabet soup when you start to go through it, and you have to look at what all your options are. But on the Medigap, and you also do the drug enrollment.
Yes, we do. Every year there's an annual open enrollment for Medicare. That's October 15 to December 7, where people can make changes to their prescription plans, to the Medicare Advantage plan, or they can go from a Medicare Advantage to original Medicare, or vice versa. But that's the time that someone can make changes to their plan. So it's October 15 to December 7 of every year.
Right. Now, Amanda, I know before I left today, we all worked together, and Amanda was busy at her computer enrolling somebody, because it's after the deadline for them to enroll. So what was this person new to Medicare that you were enrolling?
They were new to Medicare from the standpoint of they were on disability.
Okay.
And after being on disability for 24 months, you can automatically get enrolled into Medicare. And however, this referral came to us from the state, and there were a number of questions, because after further research, yes, they were enrolled in Medicare, traditional Medicare Part A and B, but they were not enrolled in a Part D or prescription drug plan. So today, that is something that I reviewed with them and his daughter-in-law. Again, he had the assistance of having a daughter-in-law help him navigate, which is really nice. Yeah. And then I also told them that I would be sending them information about the supplemental plan, as well as letting them know if he qualified for the Medicare Savings Program.
Okay. Okay. And Magaly, what does the Medicare Savings Program do for people?
It gives them many benefits. One of the main one is it helps them pay for the Part B premium. One of the other benefits is that automatically they get extra help. It's a federal program which helps them pay for their prescriptions. It lowers their co-payments.
But they're lower. They pay a lower cost if they're on the Medicare Savings.
Yes, and it may also help them pay for the prescription plan. Prescription plan has a monthly premium, and the state helps pay for 6 different plans, known as benchmark plans, and they pay that premium in full. Or if they decide to go with another plan, it may help them pay partially for that premium as well.
So what you and Amanda do, is you help someone go through these plans to see which one is going to cover most of their drugs or all of their drugs. Is that it? I think, Amanda, you were telling me this particular person took a lot of drugs, and you were able to find a plan that covered all of his drugs?
Exactly.
And it was a benchmark plan?
It was a benchmark plan. It had a good rating, and it's a plan that, in terms of name recognition, that they knew, and so it worked out perfectly for this individual because, again, it met all the needs, and it covered, surprisingly, all his drugs.
Right.
He had a list of probably close to 12 drugs that he was taking.
That's a lot of drugs, and all the drugs were covered.
Exactly.
But this is what choices can do. They can run these drugs through the drug plan finder to find out what drug plan is going to work the best for you and help you out, and they are going to let you know about extra help if you need it. And again, I'm here with Magaly Bravo, and she is the regional coordinator for Choices, and I am here with Amanda Halle, a volunteer for Choices, and we're glad to have both of you talking about the confusing subject of Medicare. We used to call it the Medicare maze, which it certainly is. Could you tell Magaly a little bit about Medicare A and B? There are so many people now, they're working past 65, okay? So if they're working past 65, what happens to their Medicare? They're not getting a Medicare card in the mail, is that right?
It all depends. If someone is working and they have employer's insurance, if that employer's insurance is credible, they don't need to sign up to Medicare right away. They can wait to be enrolled into Part A and B. That's as long as that employer's insurance is credible. If it's not, then we advise our clients to enroll into Part A and B to avoid penalties coming up. When someone enrolls into Medicare later after 65 and they haven't had any credible insurance, they may encounter penalties by Medicare.
Right, I think it's 10% for Part B for every year you could have had it.
Yes,
Right.
yes.
And if you take your Social Security at 62, then you don't have to worry about signing up for Medicare, is that correct? They will send you a card automatically.
Yes, yes.
Okay.
So if someone is already receiving retirement benefits, they will get enrolled into Medicare automatically. When they turn 65, they will receive a card in the mail from Social Security. It's the Medicare card.
Yeah, because I know probably, Amanda, you've gotten calls from people that are 65 and haven't collected Social Security and wondering, well, where is their Medicare card?
Exactly.
You know, and it's, you know, and what do you tell them?
Well, if they're 65 and they're
Not collecting
not-
Social Security.
right, I suggest that they get in contact with their local Social Security office
Correct.
and let them know that they are interested in getting Medicare and getting the information about it.
And Magaly, can they apply online for Social Security?
Yes.
For Medicare?
For Medicare, yes, you can apply in Social Security website, and it's a very fast application. And I actually helped a client last week with enrolling into a Part B, and it took probably a week, latest 2 weeks, to get their Medicare card now that they have enrolled into a Part B.
Oh, that's great.
Yeah.
So this way here, and also, I guess you call Social Security if you've lost your Medicare card.
Yes.
This happens many times with many
Yes.
different people. You know, you're
Yeah.
not supposed to put your Medicare card in your wallet. And where does everybody keep their Medicare card? In their wallet.
Exactly.
Yeah, they can do that also online. If someone loses their Medicare card, you can also request a new one through Social Security.
Oh, okay.
You can even create an account with Social Security, and you can request it that way as well.
Right, and I do know that you can go to mymedicare.gov, which I've gone to myself, and you can sign up and you can see all your summary notices and exactly what you have for Medicare, which is very good.
Yes.
And this is the advantage of online, because what we're noticing is if you apply for the Medicare Savings Program online, and if you are eligible, you hear back much sooner than if you submitted hard copy and submitted it through the mail. And that's true of, as you just said, about signing up for Medicare. But not everybody has access
Right.
to computers. But I do ask them when I speak to the callers, because you never know. Some
Right.
people are very savvy, or they have a family member that can help them, and that's what I also encourage them to do.
That's always wonderful, I think, when you have a family member that can help you, because I'm sure, Magaly, you've had many people call, and there's obviously, we work with seniors, so they're seniors where they're disabled, and they really don't know where to begin. They don't know how to use the computer. They are just at a loss as to what to do. You know, so Choices is a very big help there.
Yeah.
And you have field offices?
We are, Western Connecticut Area Agency on Aging, but there's 4 more agencies in the state of Connecticut that takes care of the rest of the towns in Connecticut. We do the 41 towns, the western side of Connecticut, and then the other agencies are in charge of the other towns in the rest of the state.
But do you have someone in Waterbury that's at the Brass Senior Center, right?
Yes, yes.
That's what I
Yes.
meant. So you have
We-
different sites where people are.
Yes, we have volunteers and also professionals who become Choices certified counselors, and they're in our different 41 towns. They're either at senior centers, or sometimes they have senior activities at church. They're at different places, but they are Choices counselors out there, certified by us, by the state, who can help clients at different sites.
Very good.
Yep.
Now, this is a crazy question, but geez, do you charge for your services?
No, we don't.
No? Okay.
We don't charge. It's free, completely free. And the great thing about us too is that we are unbiased. So we do not get any type of commission, nothing at all. So the information that we give is completely unbiased and it's free. We provide the information to the client for them to make the best decision, and we'll provide as much information as possible to help the client make that decision.
And I think that's so important when you're new to Medicare and you're going through all the plans. There's so much to go through.
Yeah.
I'm sure, Amanda, after taking the training, because you took the Choices training, your mind was going, oh my God, where do I begin?
Well, and it's good. And the other great thing is that, yes, you take the training, you do have to take a test, pass the test, but then they have refresher courses. In other words, you have to take the subsequent training.
It's always changing.
Because, as we know, each year Medicare, CMS comes out with new information, new guidelines, and it's really important to be up to speed.
Now, how long was the training for you?
It was, I believe, 6 to 8 weeks. I'm thinking back. 1 day a week for a number of hours. It was like a 4 or 5 hour session.
Okay, it's all on Medicare. You must have been.
It's 1 day for the 6 weeks. So it's,
exactly.
Yeah, so it's a 6-day training, just 1 day every week. Okay. And then we touch different topics. You know, we focus 1 day on just Medicare Part A, the next day Part B, Part C. You know, it's a full day as well.
Now, Medicare Part C is Medicare Advantage for those of you that don't know.
Yes, and all of them, they're very complex. So we want to make sure that we give the person enough time to understand it or ask questions when we do the trainings.
Okay, which is very good. And like you say, you have to take a test to pass it, and then you are a choices counselor like you are, Amanda, which is nice.
And what's really interesting about the training sessions is the people that come in to train or to be certified come from such a variety of different backgrounds.
Right.
So many times they're asking questions that are, yes, relevant to their situation, but that's all part of the wonderful learning process.
Right. Now, if I'm right, Magaly, they cannot be a professional person, is that correct?
No, they cannot be insurance brokers.
No insurance brokers. Okay,
yes.
so if you're an insurance broker, no choices training for you.
Yes,
okay,
yes.
Unfortunately.
You know, if a social director of a senior center would like to take the training, we're welcome to it. If just a social worker or a case manager would like to take it, you're welcome. If someone's interested to become a volunteer, they can take the training as well. The only thing we cannot do is train insurance brokers because of the fact that our services are free.
So I would encourage anyone out there, if you are a social worker or a senior center director and you're new, because there's a lot of change of staff lately, to please take the choices training. And to find out about the choices training, they would call the number on the screen. We have our number up there.
It's 1-800-994-9422. That's our 1-800 statewide.
And we have the direct number up there, which is 203-757-5449. And ask for Magaly.
Or the Choices team.
Or the Choices team.
Yes.
And we can let you know when the next Choices training is coming up. But it
yes.
is, and it's going to be held at our office, I believe.
This year it is, but you can call us at any time, and we'll provide information on when the next training is going to be, and we'll give you more information if needed.
Yeah,
yes.
and usually you get, I mean, when you took the class, Amanda, did you have quite a few people in your class?
Yes, I think we had about 15 to 20
about
people.
15, so you had quite a few people in
Yep.
there. Yeah, it's very popular with now, I find, people that are retiring or looking for a little something to do, so they take the choices training, and we've gotten some wonderful, wonderful, well-educated volunteers out of this program. It's really phenomenal.
We want to thank them too. We want to thank all of our volunteers in our agency and statewide, because this is not an easy program. It takes a lot of time to learn the topics, to start counseling to a person. So we want to thank all of them for their time and their commitment to this program.
Absolutely.
It helps. It
Absolutely.
really helps
I was
us.
talking to Amanda on the way over, and she said coming into the agency and starting to get the phone, then you get a little taste of what's going on. And the first phone call is really the most scary phone call. I need some Medigap information. All of a sudden you're thinking, oh my God, what is that again?
What is Medigap?
But it all comes back, and we have a variety of resources at our agency, all agencies do, of choices counselors and choices coordinators. We're very fortunate in Waterbury to have Magaly, because she is very educated on the subject.
Absolutely.
And she does the trainings and things like
great.
that. How is Choices funded?
It's funded by federal agencies. As I said before, it's a SHIP, but it's funded by the federal agencies.
Yep. The federal and state? You get state money from it too?
I believe it's just federal.
Just federal money?
Yes.
Okay, I thought it was state too. But
Yeah.
And now, is there an age limit for somebody to call Choices?
Not an age limit. We focus on, like I said before, Medicare, Medicaid. So it's someone who is 60 years and older, or someone that, a person with disability, they can call us as well.
Okay. And do you have like housing options, transportation options that are there that you can provide people?
Yeah, we do information and referral as well as part of our program. So if someone calls us with a type of situation like that, or they need housing information, we can refer them, or we have booklets with information on how to go step by step.
Oh, okay, that's very good. And so there's no age limit as long as you're on Medicare, basically. Okay.
Yes, that's our focus.
And do you help people complete applications? You know, some of these applications I've looked at, these Title 19 applications, you know, if you're going to go on full Medicaid, it's like 25 pages, I'm exaggerating, long. But do you help people with different applications?
I think you're not exciting. I think it's about 25 pages.
No.
But we do. We help them with the applications. We have the applications in our agency. If someone would like us to mail them to them, we do. Or if someone is stuck in a question, then we help them as well explain what information they're asking for. Or if someone would like to come to our office to make an appointment to fill out the application, we can do that as well.
Right.
Yep.
And if I'm correct, a lot of the municipal agents in our 41 town area should also be able to do this too. Am I right?
Yes, yes.
So if you're living, let's say, in Newtown or in Watertown, Morris, you should have a municipal agent that will fill this information out for you. They should know how to do this already.
I believe so, yes.
So it's like
yes.
a network out there.
Yes, yes. I mean, it's there's a lot of seniors, there's a lot of people with Medicare or disabilities, and we're all out there trying to help, you know.
Well, we're very fortunate, like I said, at the Western Connecticut Agency on Aging to have Magaly Bravo. I keep getting your last name wrong. I don't know why. As our regional choices coordinator, and
We certainly are.
Amanda Halle is our volunteer. What do you like most about volunteering, Amanda?
A couple of things. One, when you field the calls and you get the sense of how confused your client is and frustrated, and you know, sometimes sort of desperate because sometimes there are deadlines that they know are impending, and you're able to walk them through it, and they're so appreciative after you take the time and sort of bring them away off the cliff because they're so nervous about making the deadline, understanding it, that it's a really wonderful feeling because you feel that you have truly helped them. I love the resource of having Magaly there and some of the other counselors, Ed, Darryl, Dawn, yourself, so that when I have a question, I don't hesitate to put the client on hold and ask you all. And I think that's a great asset. So it's not only interacting with the client, but also interacting with the staff at the agency.
We're a good team.
Yeah, I think so.
Exactly.
Magaly, what do you like most about your job?
I like the fact that we're unbiased.
I think
just
that's
like
very
Amanda,
important.
just like Amanda said, sometimes we get a call of someone who's frustrated, who has called many numbers, and no one can give them the information that they need, or no one took the time to explain them what's Medicare or what they should do next. And I like that, giving them information and empowering them to do the best options.
Oh, okay. That makes it nice. I always remember when I was doing choices. I'm doing Medicare fraud now, but when I was doing choices, I had a gentleman and came in. He's quite old, and he says, "I need help. I need to save some money." And I didn't know what to do at the time. I was new, like Amanda, and I was a volunteer, and I did help him get on the Medicare savings program. And he was so thankful when he left. He was actually crying. I mean, when you can help somebody like that, it is just beyond words, the feeling that you have, you know, and it hasn't cost you a nickel to be kind to somebody and to listen to what they say and to listen to their problems. As I'm sure both of you have had clients on the phone and they're going on nothing about Medicare, and you're listening to their problems, and it just makes them feel better.
Absolutely.
But I'm very fortunate to have, again, Magaly. I thank you very much, Magaly Bravo, the Regional Coordinator for Choices, and Amanda Halle, our volunteer from Choices, and we have several other volunteers that Magaly has at our office, and we are thrilled to have them all.
Yes.
And I want to thank all of you out there for watching our show, Working Together with the Western Connecticut Area Agency on Aging. Together, we can help you with many programs available to keep you in your loved one's home and safe. Thank you.